Myself, Dr. M.B. Ramamohan, Consultant Endocrinologist, Diabetes and Endocrine Clinic and Apollo Specialty Hospitals, Nellore. Today, we are going to speak about World Diabetes Day and Type 2 Diabetes. On November 14th, we are celebrating World Diabetes Day. The theme of World Diabetes Day is to protect our future by educating everybody about Type 2 diabetes. Mainly, the Type 2 diabetes treatment plan depends on the education of our patients and their family members about their disease, their future complications, and what are the plans for them to prevent the complications in the future, to have a healthy lifestyle, to have a happier life in the future. Mainly on November 14th, International Diabetic Federation came with a conclusion that to have a awareness about type 2 diabetes among all the community members in India and worldwide, so that we can have a good plan for the future diabetic patients to prevent diabetes, and the patients who are having diabetes to have a healthier life in the future. There are 2 to 3 types of diabetes present. Mainly type 2 diabetes occurs in elder patients more than around 20 to 25 years of age, and these patients tend to be obese. They have insulin resistance, that's a term, where these patients tend to have relative insulin deficiency among them, and because of their obesity there is an increased workload of the pancreas and would tend to fail at the end, and there is a deficiency of insulin also occurring in these patients. Generally in type 2 diabetic patients, we tend to control their blood sugars by tablets itself. As the disease progresses, the tablets we tend to increase the doses, and maybe more than 20 to 15 years of duration of diabetes, they may need insulin in their future. But it is not a hard and fast rule for everybody that every type 2 diabetic patients ends up in insulin. So mainly the control of diabetes in type 2 diabetes mainly depends on good dietary control, good healthier lifestyle like having a regular exercise, then good tablets or good treatment plan with a consulting endocrinologist. The main aim of this control of diabetes is to prevent the future complications in diabetes. Mainly in type 2 diabetes, as the disease progresses, with uncontrolled diabetes, patients tend to have diabetic retinopathy, where there is a problem with their retina, diabetic neuropathy with their nerves, diabetic nephropathy, problem with kidneys, and also they have problems with like macrovascular complications, like they can have heart strokes or brain strokes. The main aim of treatment in type 2 diabetes is to prevent their future complications, so that the patients will have a normal lifespan without morbidity and mortality. Mainly the control of blood sugars is very important part, to keep their HbA1c levels under 7 or 6.5, and to keep their fasting blood sugar less than 120, and to keep their postprandial blood sugar less than 170 to 180. This is the targets commonly we keep for all the type 2 diabetic patients, and we educate every type 2 diabetic patients to have a good control of diabetes, so that their future doesn't have any morbidity related to all the complications we are facing. So the main type 2 diabetic patients treatment plan will be having a good follow-up with endocrinologist, to have blood sugars checked every 1 to 2 months at the home or with a doctor, to check their creatinine level or kidney levels at 6 months duration, to check have a ECG or thyroid levels at the end of 1 year, to check their eyes with retina checkup at the end of 1 year. So to have a proper plan for type 2 diabetic patients is very important for their betterment, and to have a good rapport or good communication with the doctor, to have all the questions or all the myths cleared about type 2 diabetes is very important in educating the patients, giving knowledge to the patients about the disease, and clearing all the myths present in our society to prevent the complications is very important. So on this World Diabetes Day, I want to pledge with all the doctors that we will keep educating our patients, increase awareness among all the doctors and families of diabetic patients, with patients themselves, so that they have a good knowledge about their disease, so that they will be having good blood sugar control and they will be having a complication less future. Thank you so much.